U.S. fertility rate hits record low. What's behind the decline? The United States is facing a significant demographic shift as its fertility rate has plummeted to an all-time low of 1.6 children per woman, according to the latest data from the U.S. Centers for Disease Control and Prevention, CDC. But here's where it gets controversial. This decline, which has been ongoing for nearly 2 decades, raises questions about the future of the nation's population growth and the policies that might influence it. The fertility rate in the U.S. has seen its ups and downs over the years, peaking at 3.5 children per woman in the early 1960s, dropping to 1.7 in 1976, and rebounding to 2.1 in 2007. This trend is not unique to the U.S. Lower fertility rates are common in wealthier countries, and the new figures place the U.S. in line with its Western European neighbors. But what factors are driving this decline? Experts point to economic stability and the affordability of necessities like housing as key influences. Leslie Root, a researcher at the University of Colorado Boulder specializing in fertility and population policy, explains that while the U.S. population is still growing overall, with more births than deaths, the trend of delayed fertility is significant. Karen Guzzo, director of the Carolina Population Center at the University of North Carolina, adds that financial concerns can be a major deterrent for having children. Worry is not a good moment to have kids, she notes. This economic pressure is a critical issue that affects not only family planning, but also mental health. Some lawmakers are sounding the alarm about declining fertility rates and are advocating for government intervention to encourage childbearing. During his presidency, Donald Trump proposed changes to tax policy to favor families with children and issued an executive order to reduce barriers to fertility treatments like in vitro fertilization. At a Women's History Month event, Trump even referred to himself as the fertility president. However, the administration also made cuts to social programs that provide crucial support for working families, which experts argue could exacerbate financial stress and further discourage childbearing. Additionally, funding for medical research into fertility treatments was reduced, potentially limiting access to these services. Guzzo points out that while these initiatives may be symbolic, they may not significantly impact the real-life challenges faced by American families. As the U.S. continues to grapple with this demographic shift, it's clear that the interplay between economic factors, public policy, and individual choices will play a crucial role in shaping the future of the nation's population. What do you think? Should the government play a more active role in encouraging families to have children? Or is it up to individuals to make these decisions based on their own circumstances? Share your thoughts in the comments below. U.S. fertility rate hits all-time low. What's behind the decline? The U.S. is facing a fertility crisis like never before, with the average number of children per woman hitting a historic low of just 1.6 in 2024. This alarming trend, revealed by the latest report from the Centers for Disease Control and Prevention, CDC, published on Thursday, marks a significant milestone in the country's long-term demographic shift. But here's where it gets controversial. Despite this record low fertility rate, the total number of births actually increased by 1% last year, reaching 3,628,934 babies born in the United States. That's a paradox that raises important questions about the relationship between fertility rates and population growth. The steady decline in fertility rates has been unfolding over many decades, influenced by societal changes, such as couples choosing to marry and start families later in life. This delay is often due to factors like pursuing higher education, career development, and economic considerations, all of which contribute to having fewer children overall. To break it down further, between 2023 and 2024, the fertility rates fell among women and girls aged 15 to 34, stayed steady for those aged 35 to 39, then surprisingly saw an uptick in the 40 to 44 age group. This pattern hints at more women opting to have children at older ages, possibly using advanced fertility treatments or simply delaying childbirth. Adding to the complexity, the proportion of births delivered via cesarean section nudged up slightly, from 22.8% in 2023 to 22.9% in 2024. Although this increase seems minor, it reflects ongoing changes in childbirth practices and healthcare preferences, which could also impact maternal and infant health outcomes. The dramatic decline in fertility rates hasn't gone unnoticed at the policy level. The Trump administration, for example, attempted to respond by exploring various measures aimed at encouraging higher birth rates in the U.S. One notable action was an executive order designed to reduce the cost of in vitro fertilization, IVF. IVF is a fertility technology where sperm and eggs are combined outside the body to create an embryo, which is then implanted into a woman's uterus. By making IVF more affordable, the administration hoped to help more couples struggling with infertility to have children. In addition, a more debated approach was also under consideration, offering new mothers a $5,000 baby bonus payment after giving birth. This idea sparks heated discussion as experts in demography generally remain skeptical about whether financial incentives alone can meaningfully boost fertility rates. History shows that similar policies in other countries have often failed to produce sustained increases in birth numbers, prompting the question, can money really influence deeply personal decisions, like family size? This situation raises some provocative questions for all of us. How much should governments intervene in personal reproductive choices? Are financial incentives effective or even ethical as a population policy tool? And what might the long-term effects of continued low fertility be on society, the economy, and healthcare systems? We invite you to share your thoughts. Do you agree with the approach of trying to raise fertility rates through incentives, or do you think efforts should focus elsewhere? This topic touches on personal values, economic realities, and societal futures, making it one of the most compelling debates today.